Doctors of Reddit, what was a symptom a patient didn't mention that was really important? 16-0. Came in with blood pressure of 60/30, pale as a ghost, tons of free fluid in his abdomen on ultrasound. Turned out he had metastatic testicular cancer that had eroded into his aorta and was bleeding into his belly. Come to find out later he had testicle lumps and was too scared to tell anyone. And X200B. Edit, for those asking, we resuscitated him with blood and fluids and transferred him to the nearest PEDSICU. He was treated, lived a few months and passed away. It was incredibly sad. I think of him often. Oh duck, did he live? I had a guy come to the hospital who told me he had seizures every Tuesday like clockwork. This is highly unusual for somebody with a seizure disorder. It wasn't until I asked him about his social history that he told me he's a heavy drinker. I investigated further, and it turns out he binge drinks Thursday, Friday, Saturday every week, then stops cold turkey. He was having withdrawal seizures. This is terrifying. Holy shocks. How much did he drink? That has to be an exorbitant amount. I had a patient whose main complaint was a wrist sprain. Asked how he fell and he said he felt lightheaded and fell down the stairs. After about 15 minutes of questions about his heart and other stuff, I asked him if he's had any vomiting. He said he vomits every day. I asked if it's red and he said it's bright red every time. The kicker is this was his usual yearly appointment. Dude was vomiting blood every day and not only did not go to the ER, he didn't feel it was worth mentioning at his checkup. So what was his issue? Obviously vomiting blood is not okay, but why was he vomiting blood? Goddamn health class needs a section on don't ignore these symptoms just because you can still go about your day. Yikes. I had a patient who needed a small sterile procedure done but had a latex allergy and it was in bright red all over her chart. We used paper charts back then. We had just ran out of latex-free sterile gloves. I went in to tell her she needed to come back in a week when we got them back. Then I decided to ask what happened when she came in contact with latex. Her response: I get chlamydia. What even? Was she married or something? I can't think of any reason besides having multiple partners and wanting to hide it to pretend to have such an allergy. A few months ago a woman, 36-year, consulted to endocrinology because she was getting fat without a change in her diet and she felt different. Asking more questions, she casually mentioned she hadn't had her menstruation for months and that maybe she was menopausal. At 36, we suggested that she might be pregnant and she said it was a stupid idea and that she knew she was not pregnant. We did some analysis and an echography and yep, 35 weeks pregnant. You give birth at around 40. There's a whole reality program I didn't know I was pregnant about women who didn't figure or couldn't admit they were pregnant. Recurring question was, didn't you feel it moving? I'm a doctor. Back in school I had a patient who was a drinker, wasn't feeling great and wasn't sleeping well lately. Asked him how the drinking issue was going and he said he lost the taste for it. Alcoholics can quit. They can stop. But they don't just lose the taste for it. Cancer. Would you mind elaborating? Not a people doctor, but I worked as a vet tech for 3 years. Had a little tiny mini she TZU in horrible health with a nasty attitude to match. You could seriously barely touch the dog and she was very sick. The only reason we were able to do anything for her was because she was so small. Owner comes to visit her one afternoon and casually mentions to us that she's deaf. Poor thing was scared out of her mind and did remarkably better once we learned to let her know we were there before touching her. Former tech here, and people really don't want to tell you that their pet ate pot. We don't give a shocks if you smoke it and we're not reporting you, but we need to know what your pet ate. Well, how is the patient supposed to let you know? They can't talk. Ington resident here. Never ever lie about your alcohol or drug use. Had a healthy patient go in for a simple elective inguinal hernia repair. Had a massive heart attack on the operating table, then several more in the ICU, and he eventually died about a month later. Turns out, he had been using meth prior to and even the day of his elective surgery and had lied about it. Lying about alcohol use can kill you just as quickly. More often than not, your healthcare provider won't judge. Just be honest. I had a patient come in with a neck mass. There was enough of that he got the beginnings of a malignancy and infection workup that was remarkable for the mass being a hematoma. Then he remembered he was in a car accident and the seatbelt was where said mass was. I can't understand. Oh shocks, yeah, that accident I was in. The one that caused the injury I'm here for. Yeah, that happened. That is some name you've got there. Not a doctor, but I'd been working with a doctor about getting back on antidepressants. I mentioned my upswings, where my depression was gone. I was super productive. I didn't feel hungry. I could stay awake for days without being tired, and I had endless energy. And turns out I'm not depressed. I'm bipolar. I've been experiencing some form of mania. I went through all of high school not having a clue I was bipolar. I only looked into it during college, when my lack of productivity was becoming a serious issue. So many things suddenly made a lot more sense related to this, but it's why antidepressants can have an increased suicide risk. Some will start giving the person energy back before it touches their depression symptoms. A lot of suicides occur when people are extremely depressed and have energy to do something about it. Nice. Please smash the subscribe button to enjoy daily AskReddit content. Not a doctor, but I ended up in the ER due to my heart begging to race while I was not doing anything active. I go over everything that's been going on. They run a few tests that all come back normal except for my LFT, liver function test. They ask about how long I've been tired and struggling. Since I have a chronic illness, I just tend to mark it as that. Nope. Drug-induced hepatitis. Was taken off all my meds to find the culprit. Acetaminophen was slowly killing my liver and could have led to much worse consequences. I just remembered that did happen to me. My medication was attacking my liver. My amazing doctor, I've since had to switch, was able to catch it before it got too bad. Acetaminophen, otherwise known as Tylenol or paracetamol, is one of the most common causes of liver failure. As a kid I was always out of breath and could hardly do any physical activity. When I would run or laugh hard, or go up the stairs, my legs, arms and trunk would tingle. Thought I mentioned that to my parents a few times, but at the doctor all that was ever said was I wasn't very active. Ended up passing out in gym class at age 8, and being diagnosed with a cardiovascular problem about a month before it would have killed me. The tingling and dizziness should have been a good clue. See, I'd like to think this is why I feel like I'm dying every time I exercise, but then I remember I'm 27 and probably just really out of shape. Medical student, Bill had this conversation with a patient. And X200B, what can you tell me about your health? And X200B, it's good. I exercise 3 times a week. I eat right. And X200B, oh nice. Any diseases or illnesses that you have or that you are concerned about? And X200B, nope. Just here for a physical. And X200B, any medications that you are on? And X200B, oh yay. Metformin and simvastatin. And X200B, metformin for diabetes and simvastatin for your cholesterol. And X200B, yay. And X200B, haha, better get used to it. Every day, I give the patients the benefit of the doubt and that maybe they think we mean any problems we don't already know about. Nurse here, had a man come in complaining of urinary retention, which could be because of his age. He left out the weakness and numbness in his legs that had been going on for almost a month during all of his assessments. These assessments were by both doctors, urologists, and nurses. He always denied any other symptoms besides urinary retention. He suddenly stopped being able to feel or move below his belly button. MRI of his back showed cancer into his spinal column and he died 8 months later. Man, for a second I thought I knew who the guy was. My friend's dad is going through this exact situation right now. Like, everything from ignoring symptoms to paralyzed from the waist area down, to the cancer on spine discovery. So Tridge nurse doing phone Tridge. Member had high BP 180/90 due to not taking BP pills. This was not outside her unmedicated baseline. I asked if she was having shortness of breath or chest pain. She said no. Booked her a same day apt after talking with her provider. Was having a heart attack with both chest pain and breathing issues when she came to her apt. Don't lie, people, seriously. Had to call an ambulance. That's such a weird thing to lie about. You could literally die. Why lie? Related story. Children's doctor noticed my weird way of holding my phone and diagnosed me with cerebral palsy. Everyone thought I was just weird, but there was no other signs at that point and I wasn't even there for anything related. But was the diagnosis correct to any degree also? How do you hold phones? Slightly off topic, but working the back of an ambulance rig riding with a 45YOF patient who had slipped and smacked her head on a washing machine. She tells me as we pull up to the hospital that she had a previous event when she was 19 where she fell off the back of a pickup truck when parked and hit her head, went unconscious, and started seizing. She coded 3 times on the way to the hospital and was in a coma for a month. Wouldn't have changed the current situation much, but knowing she was sensitive to head trauma would have had me on my toes for sure. What do you mean by coded? My doctor forgot to look at my chart and did the test. I went back after the test and she said, "You need to be on X medication." And I told her I was already on it. She was shocked. And it changed my diagnosis because it should have improved treated me and didn't. Edit. A word. Not a doctor, but this happened to me. I had to see the doctor to discuss some tests, so spent some time talking about that, and as I got up to go I remembered a message that the optician had said to tell the doctor about a mark on my eye. And the doctor got very serious and said, "That's really important," and then we discussed the implications of that, but I thought it was something really minor. What ended up being your diagnosis?